Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we've modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's vitally important from the Western New York community to hear from our medical experts who are leading the charge in our facilities with our workforce over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Okay, Jody, thanks for joining us today on Medically Speaking, obviously practicing safe social distancing. Tell us how things are going with the health system and across the hospitals.
The way I would say, and thanks, Mike, the way I would say it for all of us is really it's going as well as it can be in the situation we find ourselves. And that's really a credit to the entire system, to all of our caregivers, our team, you name it. So everybody seems to be at a heightened sense of awareness. Obviously, everyone seems to be doing their best to adhere to all those really common sense things that we continue to talk about. But as we all know, I mean, we're a little anxious. I mean, each and every one of us, we're a little nervous. But, you know, the one thing I will say, and again, to the testament of this organization and the incredible people that work at this organization, is these people just really want to care for the community. And because of that, they're wickedly prepared and feel really good about that.
Yeah, we've heard a lot of stories about staff who continue to come into work, they come in to face this head on. So if you can, tell us a little bit about the feedback you've gotten from the staff and, you know, what you're thinking about the staff as they, you know, battle this for the last week or so.
Yeah, it's interesting because, you know, these are people who've dedicated their entire lives to caring for others. These are people who have spent their entire lives dealing with crisis. And obviously, this is something none of us have really ever seen. And to their credit, I mean, they're just putting that their badge on each and every day and really doing phenomenal work. What's important for us as an organization is to continue to support them, is to continue to give them comfort. You know, and you've probably heard me, I know you have, but the community's probably heard me over and over like a broken record talking about the absolute need for us to keep our healthcare workforce safe and healthy as best that we can. And there's multiple ways we're doing that. We're screening at the front door. Obviously, we've decanted most of our entire organization almost to the bare bones at this point. And so making sure all of our employees have the proper PPE and giving them all the comfort that they need because they want to take care of us. And that's really the beautiful thing that's come out of this crisis. This is just one more opportunity for us to say thank you because they validated all that we know, that they're the best of the best.
Right. One of those things that you talk about when you talk about taking care of your staff is, you know, masking everybody and the need for supplies. I know late last weekend, we put a community push out for additional masks and we got an overwhelming response from some of the Western New York organizations, individuals, you know, building trades, folks like that. Talk a little bit about that issue and how we are using our friends in the community who want to help, how they can help us moving forward with taking care of our employees.
Yeah, this is again another incredible and obvious example of why this is just the greatest place in the world when it comes to being a part of this community. So we put, as you said, we put this push out. We did everything we can. I mean, we turned out, looked everywhere under every stone to try to get any type of PPE, gowns and gloves and masks and so on. And what we're really thrilled about was the result of that is that very shortly we will be announcing that we'll do universal masking throughout the organization, which again is just one more step to give great comfort to our employees, to keep them safe and healthy. But that, you know, a lot of work goes behind the scenes to do that. And you know, it's interesting because I've said this, and I think every one of us has seen multiple elected officials on TV each and every day doing really, I think, yeoman's work trying to get this message out but the need is a global need. And I don't know if I've ever been a part of where there's been a global need. So everybody's looking for ventilators. Everybody is looking for masks. And, the beautiful part about Western New Yorkers is Western New Yorkers love to take care of Western New Yorkers. And I remember I had an unfortunate incident, obviously, years ago at ECMC. And one of the lines that came to us at that time was, ECMC, we've taken care of the community and asked the community now to take care of us. Well, I think as a healthcare system, we're doing that again. The community's taking care of us because these people, these healthcare workers and our frontline staff are just doing a phenomenal job taking care of the community.
So when you say universal masking, that means you're taking the extra step and making sure that there are masks available for all employees while they're working here. So not just those who are patient-facing or those who may be in clinical areas. So is this something where it's more peace of mind so the workforce can come in and not have to worry about, all that's going on around them?
Yeah, it really is. And here's the thing. You heard me say this last week. And even after we post this video, our lives will change again. So it'll be different guidance and so on and so forth. But what we heard loud and clear was people want to be masked. They want that comfort. They want that safety, and rightfully so. You've also heard me say, if we could do it, we will do it. And so I'm proud that we are going to be able to do that very, very shortly. And that's whether that's a comfort or whether it's guidance, if that's what people need and that's what people want, then we're here to support them so they can do their job.
Jody, I know there's been a lot of talk in the community about testing kits and the need for testing, and whether it's, with the county or others. What's your take on that issue? And, does that change what Kaleida Health is doing or what we're doing to take care of patients?
So let me break this out a couple different ways. So let's talk about what we know and what we know as fact. The virus has spread. So this is not news, a news flash. It's spread all over. The assumption that we should be making is that we have come in contact with someone who has COVID-19. So in saying that, what really works and what really is going to, and you've heard the governor and whomever else, the county executive speak about bending the curve or flattening the curve. It is social distancing. It is staying home if you can, and it is washing your hands. So if we do those things, what does testing do? So here's what we're doing at Kaleida Health. We're testing our own employees. Again, back to what's our goal here? Our goal is to keep the healthcare system upright. Our goal is to keep the employees safe and healthy so they can take care of all of us. So that's our number one goal. That's who we are testing, and we're going to continue to do so. We're obviously testing very sick patients inside the hospitals as well. Let me take it a step further. I don't want to confuse the community. I'm not suggesting that testing is bad. I'm not suggesting not to do testing. I'm only suggesting that there's a reality to it. If I get tested right now and shortly I get news that I'm negative, I can still get the virus 3 minutes later, 2 minutes later, pumping gas, doing something else. So it's all of those other things that we need to do to be compliant. So the testing isn't a panacea. It gives us guidelines. But how much more do we need to know? It's out there. We know it's out there. So it's up to us, each and every one of us, to do the things that we can do to stop the spread.
So in saying that, as we wrap up, we've obviously have seen the advice to the community that Kaleida Health has been pushing on. You're doing an awful lot to take care of the workforce, including the physicians and nurses. If you can close by any thoughts, any messages to the frontline staff at this time?
Oh, it's always thank you. And I couldn't be prouder to be a part of this organization. I couldn't be prouder of what they do each and every day. It's just another shining example of the talent, the dedication. The most loving people in the world are working right here, taking care of us and putting themselves, quite honestly, we know this, in harm's way. But they do that all the time. They do it each and every day. This is just one crisis, and I don't want to minimize it, but it's the reality of it. And so we will get through this. we'll be a better community because of it. We'll be more prepared, certainly for the next time this happens. And I think Kaleida Health will be a much better organization. In times of great crisis, some things really start to happen. We put some of our differences behind us and we work together for a common goal. That's happening throughout this entire organization. So I can't thank everybody for having a single goal here. And what's our single goal? To keep this workforce healthy, to keep this community healthy. And then let's talk in a couple of months. Hopefully we're past this and we're on to something else. But I'm just so honored to be a part of Kaleida Health, obviously, and just thrilled at what I'm witnessing each and every day.
Jody, I know you and the team are going from morning until late at night, so thanks for taking time out of your schedule to talk to us on Medically Speaking today.
Okay, thanks, Mike. Appreciate it.